Have you ever felt so exhausted that you can't seem to snap out of it? You feel so out of it that even the simplest tasks seem impossible. Well, then you might have chronic fatigue syndrome, or CFS. CFS is a chronic disorder marked by overwhelming fatigue and other symptoms that can make everyday activities very difficult. Unfortunately, there is still a lot of mystery surrounding this condition, and a lot of people don't know how to cope with it. This video is intended to provide some information about CFS, its causes, symptoms, and possible ways to manage it. The causes of CFS are largely unclear. Viral infection, psychological stress, or a mix of variables are some of the possibilities. CFS is difficult to diagnose because no one cause has been found, and many other disorders generate comparable symptoms. CFS has no diagnostic tests. When obtaining a diagnosis, your doctor will need to rule out other possible explanations for your weariness. CFS was once a contentious diagnosis, but it is now widely recognized as a medical condition. CFS can affect anybody, but it is more frequent in women in their 40s and 50s. Although there is presently no cure, treatment can help to alleviate symptoms. Here's everything you need to know about CFS, including symptoms, treatments, and prognosis. What triggers CFS? CFS has an unclear cause. Contributing factors, according to researchers, could include viruses, a compromised immune system, stress, and hormonal problems. It is also possible that certain people are prone to CFS genetically. Though CFS has been linked to viral infections, no one infection has been identified as the cause of CFS. Some viral infections linked to CFS have been examined, including those caused by Epstein-Barr virus or EBV, human herpes virus 6, Ross River virus or RRV, and the rubella virus. People with CFS are sometimes immunocompromised, but physicians aren't sure if this is enough to trigger the condition. Hormone levels in people with CFS might sometimes be abnormal. However, doctors haven't decided whether this is significant either. CFS-related risk factors. CFS is common in persons in their 40s and 50s. Women are 2 to 4 times more likely than males to be diagnosed with CFS. Therefore, gender plays a role. Other factors that may raise your chances of getting CFS include genetic predisposition, allergies, stress, and environmental variables. What are the symptoms of chronic fatigue syndrome? CFS symptoms vary depending on the person and the severity of the disorder. Fatigue that is severe enough to impede everyday activities is the most common symptom. A considerably diminished capacity to do your typical daily activities with fatigue must persist for at least 6 months for CFS to be diagnosed, and it must not be treatable with bed rest. You may also feel extremely tired after engaging in physical or mental activities, which is known as post-exertional malaise, or PEM. This can linger for up to 24 hours after the activity is completed. CFS symptoms also include sleep disorders, such as still feeling fatigued after a full night's rest, chronic insomnia, and other adverse sleep conditions. Additionally, you may encounter memory lapses, impaired concentration, and orthostatic dysfunction, which is the feeling of dizziness, lightheadedness, or faintness when moving from a lying or seated position to a standing position. CFS can cause physical symptoms such as muscular ache, frequent headaches, pain in several joints without redness or swelling, a persistent aching throat, and lymph nodes in your neck and armpits that are painful and swollen. Some persons with CFS experience phases of feeling worse and then better. Remission occurs when symptoms fade or disappear altogether. A relapse occurs when symptoms resurface after a period of time has passed. It can be tough to control your symptoms in this cycle of remission and relapse, but it is achievable. How is CFS identified? CFS, as we've previously mentioned, can be difficult to diagnose. It affects between 836,000 and 2.5 million Americans alone, according to the Institute of Medicine. However, it's estimated that 84 to 91% of people with this condition have yet to be diagnosed. There are no medical tests available to diagnose CFS. Its symptoms are similar to those of many other illnesses. Because many persons with CFS don't appear unwell, clinicians may be unaware that they have a health problem. Your doctor will rule out other possible causes and go over your medical history with you before giving you a CFS diagnosis. They'll certify that you have at least the key symptoms listed above. They'll also inquire about the length and intensity of your unexplained fatigue. The diagnostic steps includes ruling out other possible explanations for your fatigue. The following illnesses have symptoms that are similar to CFS: mononucleosis, Lyme disease, which is a type of tick-borne illness, multiple sclerosis, lupus, hypothyroidism, fibromyalgia, depression, a major depressive disorder, extreme obesity, and sleep disorders. Certain medicines' adverse effects, such as antihistamines, can also resemble CFS symptoms. Because the symptoms of CFS and many other disorders are so similar, it's crucial not to self-diagnose. Discuss your symptoms with your doctor. They can assist you in obtaining relief. What is the treatment for CFS? CFS currently has no specific treatment. Because each person's symptoms may present themselves in unique ways, different treatments may be required to manage the illness and alleviate symptoms. You will need to work with medical professionals to create the best treatment plan for you. They can discuss the treatment's potential benefits and adverse effects with you. Lifestyle changes and home cures. Making certain lifestyle modifications could help you feel better. Caffeine consumption should be limited or eliminated to improve sleep and alleviate insomnia. Nicotine and alcohol should also be limited or avoided. If napping throughout the day is affecting your ability to sleep at night, try to avoid it. Make a sleep schedule. Every night, go to bed at the same time and try to wake up at the same time every day. Medications. No single drug can usually treat all your symptoms. Additionally, because your symptoms change over time, your medications may need to adjust as well. CFS can often lead to or be a symptom of depression. Low-dose antidepressant therapy or a referral to a mental health specialist may be advisable. If you don't get a good night's sleep after making lifestyle modifications, your doctor may recommend a sleep aid. Pain relievers might also help you deal with the aches and pains that come with CFS. If medication therapy is required, it must be tailored to your specific needs. Consult your doctor frequently. Please remember, CFS does not have a one-size-fits-all treatment. Alternative therapies, acupuncture, tai chi, yoga, and massage can all aid with CFS pain relief. Before initiating any alternative or complementary therapy, always check with your doctor. CFS is a complex condition with many unknowns. However, there are ways to manage the symptoms and improve your quality of life. There is still much research to be done in order to better understand this illness, but we hope that our tips will help those living with CFS find some relief. Have you tried any of these methods for managing your CFS? What has worked best for you? Let us know in the comments below.